Welcome. I'm Julie Thompson, Executive Director of PACTV, and today we're hosting a COVID-19 update for the town of Pembroke. We're hosting these forums every Tuesday and Thursday at 9 a.m. Watch in Pembroke on Comcast Channel 15 or online on our streaming channel by visiting pactv.org/live. To ask questions during this forum, please email them to pembrokeinfo@pactv.org. For the forum replay schedule and additional Pembroke meeting coverage, please visit pactv.org/Pembroke. Sabrina Chilcott, Pembroke's Assistant Town Manager, will moderate the forum and will introduce the participants that are contributing today. Welcome, Sabrina.
Good morning, Julie. Thank you so much for hosting this platform. We really do appreciate it.
Of course.
So as you pointed out in the past, you always date stamp these because things change on a daily basis and we always race to catch up with them. But today is May 7th. We are about 6 weeks, maybe 8 weeks, depending on what community you're in, into stay-at-home advisory, closure of non-essential businesses and governmental operations. And people at home have been great. One of the things that Deputy Chief McCormick and Lieutenant MacDonald, who are with us today from the fire department and police department respectively, have wanted to point out to people over and over again, Pembroke is doing a great job. So far, a lot of cooperation. It shows in the numbers, and Health Agent Lisa Cullity will be here as well, is here as well to discuss that as we go. One of the things, we're also today, joined by District Attorney Tim Cruz, and we have fortunate to bring on board for today a professional from Riverside Community Care. His name is Patrick Chilcott, and we're going to have a moment as we go around and do both a welcome introduction and the first statements. We're on an escalated timeline today. We're going to lose a guest in 15 minutes. That we talk about the one thing we're seeing, the one aspect that quite hasn't worked out yet. We have so much positive feedback and cooperation, but there's one outlier in the data right now that shows there's one group of people in Pembroke that are not underserved, but that are not in that same hopeful trend that the rest of us are experiencing as we count down those last 10 days. And that group of people are those who are suffering at home in silence from things like domestic violence. And we have some behavioral and mental health issues at play. And we've, in essence, by having people stay at home, put people in a position where they're all percolating and incidents may be on the rise. So before we go to the solutions expert with some links, opportunities, and some good news on that horizon, I wanted to start with Lieutenant MacDonald at the Pembroke Police Department. Good morning, Lieutenant.
Good morning, Sabrina.
We have had briefings and have seen cruisers out responding to calls. And for a while, it was very quiet. And people were engaging in their own home activities and teaching their kids gardening, cooking, doing stay-at-home work and schooling. And then there was the effects of some of that, right? And I wanted to ask you from the inside perspective to share with those of us who don't know. What do these calls look like? And when Pembroke Police responds, what are some of the things that you can do and some of the takeaways that you have? Can you get us inside the department just from that mindset?
Well, what's unique about this is they're kind of trapped in the house. They can't leave typically because they're quarantined. And then there's the increase in alcohol, so that's a problem. And then full-size family members are together in that one household. So we don't treat it any differently as a domestic. So if there's an assault that occurred, we're mandated to arrest. But at the end of the day, a lot of people think because we don't go back to that household to follow up that we don't care. It's a lot of times that just adds fuel to the fire when we go back to the house, because when they are working things out and then we kind of present ourselves, it causes more friction within the household.
I really hadn't thought of that. That's a really good point. You referenced if there were an assault, and that's a really interesting point. I wanted to see if we could throw Deputy Chief McCormick into this for just one quick second. Deputy Chief,
yes.
On a 911 call for someone who's hurt, an EMT is going to go out to that house, right?
Correct.
Yep, and they're going to get there and they're going to see things, they're going to take care of people, and they're going to do an amazing job. Pembroke loves their EMTs. They just do. You guys are amazing.
Thank you.
But now you're in a situation where you have an observation. You see something that may not look quite right. Can you talk about that a little bit? What happens?
Yeah, so under the law, all first responders, firefighters, EMTs are mandated reporters, whether it's child abuse, elderly abuse, and or something that doesn't look right, domestic violence. So we'll go in. We go in. If we see those things, we don't make light of them right out of the way. We try to go in and take care of the actual medical issue that we're there for. Separate some people if we have to. Have a firefighter go over and talk to either person to remove them from that situation or try to remove the threat or the issue from the situation. We don't really go in and, oh, hey, it's this right now and put all of our focus on that, because as the lieutenant said, that will start to ramp people up. They'll see that you're getting excited or you're kind of worried about something, and then they get worried about it. But under the law, we're all mandated reporters. So anything that we see, we either report to elderly services through the state, we report to COA, we do it to the police department. We're pretty well versed on it.
Excellent. So that communication is pretty seamless, huh? You have a lot of experience with that?
We do. We work very well hand in hand with the police department on all of those matters. So we're, unfortunately, any of those situations we're pretty well versed in.
Thank you. So, District Attorney Cruz, good morning. Wanted to throw it over to you very briefly, just to give you an opportunity, or ask you really, to help us come to grips and get our heads around domestic violence. I mean, we have as a society a tendency to shy away from that kind of a statement. There's an unfortunate mystique and ugly surrounding to that term. And without talking about it and bringing it out and looking at it, it's not possible for a community to support someone who may be suffering from that. Can you tell us a little bit about your years of experience? What are the common threads? What are the things that victims or people who may be suffering from domestic violence, what are their needs and what does that look like? How does it present?
Well, thanks so much, Sabrina. I appreciate coming back on the show today. I also want to say to all the moms out there, Happy Mother's Day is coming up this weekend. The moms, I think, especially right now, they do a tremendous job every day on behalf of all their children. But now I think they wear so many hats that as they continue on now here in this coronavirus situation, I just want to say Happy Mother's Day and please keep up the great work, teaching your kids and monitoring your kids and making sure that we can have happy households as best as we can. But having said that, you're right. I mean, we continue to deal with, in my line of work here is the prosecutor here for the county of Plymouth. And as we talk about, I talk to other people in other jurisdictions here in our county, Pembroke is no different than anywhere else. It's a great suburban community, and we're dealing with domestic violence, which is kind of, I think it's fair to say, it's to some extent bubbling beneath the surface, but it's still there. And I think the police officers and the first responders continue to show up, and they really do, I think you're right, have such a thankless job, and they wear so many hats upon arrival there, making sure if they show up, if there's a call there, making determinations of injuries, and also seeing what's the aftermath. Has there been, maybe a child has been traumatized, maybe they haven't physically been touched, but have they seen something? Have they been themselves subjected to abuse, subjected to neglect? And what we're seeing now, unfortunately, is the numbers of the reports, not just in Plymouth County and not just in the Commonwealth of Massachusetts, but across the country. We're seeing the numbers of child neglect and abuse cases go down. The calls coming in going down. I don't think it's going away. I think what we're seeing is the fact that the kids are no longer in school. The kids, and when they're at school every day, teachers, much like the police and fire, are mandated reporters. Maybe some kids aren't going to get their regular checkups right now from their physicians, which would maybe make an observation. The doctors and physicians' assistants, they're mandated reporters. So we've seen our numbers go down, and significantly in our county in the last 6 weeks or so. I think a year or so back, we had approximately 160 51As, which are the reports of abuse and neglect during the time frame. During the same time frame right now, we're down to 61. And unfortunately, I don't think that's because it's going away. I think that's because of the fact they're not being reported. So if somebody's out there and they make an observation of a child, there is help out there. Remember that. There's help out there for the domestic violence victims. There's help out there for child abuse victims. And once again, if anybody has any questions as pertains to getting that help, getting phone numbers, all that information is on our website, PlymouthDA.com. Please go on that. call our office. And if it's ever an emergency, do not hesitate to call the police and 911.
Thank you. And as a matter of fact, that was a beautiful introduction for Patrick Chilcott. It's better that you do it than I do it. I happen to know him. But Patrick's joining us today. He is a Pembroke resident. He has been many, many terms on the school committee. No longer. He has stepped down and given that seat to someone with school-age children. But he comes to us today from Riverside Community Care. They're a nonprofit organization that provide behavioral and mental health services, not technically in Plymouth County, but to so many. And he has not only been sharing, to me, which is not helpful. Today, he's come to share with everybody some of the things that not only they do, but that they see and what some of those resources may look like. Go ahead, Patrick. Thank you for coming today.
Yeah, no, Sabrina, thank you very much for having me. First, let me just say, I am not a clinical professional, right? I'm the CFO of Riverside Community Care, but I work with our clinical professionals almost on a daily basis. And I think there's a couple of things that we really have to think about here. And first and foremost is before the deputy chief or the lieutenant or even the DA can be involved, someone within that household, someone within that setting has to take a step. And it's a very personal issue that we're talking about. And I commend, honestly, the town and this entire team for bringing it out to the forefront. But I just want to set a stage for a minute. I just think about everything going on in your own households today, right? You have children at home, you have moms and dads trying to be teachers and parents and maids and everything else that are happening sort of day in and day out with this quarantine. You have people huddled together for an extended period of time, and that elevates a stress level, right? So the stress levels are already higher. Now, layer on top of that the fact that mom or dad may have lost their job, that there may be food insecurity, then there's financial issues and financial problems. That exacerbates that stress level exponentially, and it becomes almost a powder keg in certain scenarios. I think understanding the personal nature that's happening within each of those settings, which is a little different, may help us understand it. These people really need help, and they need a way to ask for help. There's a way to reach out, and it's okay to ask for help. One of the things that Riverside has is a domestic violence segment to the nonprofit, and we do just that. So folks that need help or ask for help, regardless of an ability to pay, regardless of what your economic situation is, regardless of immigration status, we will put you in touch with folks that can help. Our website is www.riversidecc.org. If you just want to reach out to us, we're more than happy to help. But I think more importantly is understanding that the individual in that setting and in that household needs to be the bravest person in this scenario. They have to take the first step in order to get anybody on this call involved. And once they do that, there are immense services around the state that will help them, that will help shelter them, that will help care for them, that will help get them the right therapy, the right help for their children, what have you. I'm going to put Sabrina in touch with our domestic violence folks today so that she can get the resources that we know of, the resources that we know are available. Because like the DA said, even though it may be on the website of Plymouth County, getting it on the website of the town, the more information that's out there, the higher the likelihood is that somebody will actually use it or be informed of it. I also just want to briefly go back to something that the DA talked about. Calls going down is a bad sign. It's not a good sign right now. There wasn't an indication that this problem was going away before this global pandemic hit and we are quarantined. What it means is fewer people and fewer kids, fewer wives, fewer domestic partners are reporting the abuse, which means that they're living day in and day out in this kind of fear. It is really important that we do everything we can to make that reporting simple, to make that first step easy. One suggestion to think about and to consider, and this is going to be a bit new maybe for some of the folks on this call, but if there was a code word that you were able to get out, It can be anything, where they may call the selectman's office, they may call the DPW, they may call the Board of Health, they may call the police department, a call that would be a normal call for somebody to make, right? Hey, I have to call about getting our trash barrels picked up. And the person answers that phone and they give a code word. You know that you might have to do a health check, right? They're just easy. Make it easy for someone to report that they need help to be able to sort of take the next step.
Thank you. That's food for thought. And I have one follow-up question, though. Naturally, sorry. Well, how do you prevent their partner or person, I would call them their, abuser, from knowing that that's what they're doing if you've publicized the existence of a code word?
Well,
I don't mean to be difficult, but I mean, make that real for me. Put that in my head in a way that we can execute.
Yeah, no, but it's not so much about the code word. It's about making a call that somebody would normally make, right?
Sure.
So making it easy, because in the course of that conversation, this person could be talking about getting their trash barrels picked up. Right? Trash is something near and dear in our town.
Sure.
Right, getting the trash barrels picked up, and all of a sudden just say something like butterfly 3. I'm making it up, but it's whatever that word is, and it just comes out. And now it requires training. It requires training for staff. There's a lot that goes into it, and that's a suggestion, right? But it's about making it easy for someone to report, so that the lieutenant or the deputy chief and hopefully the DA can then get involved and take it to the next step.
Well, one thing that's interesting to note, and it would be helpful for people at home to know, is any call that goes into the town hall, regardless of the department, whether it's the assessors, the collectors, calling about a tax bill, asking about an excise question, registry to vote, those calls are all connected through a trunk line to the police department. Anyone at the town hall has the ability to single transfer to dispatch without having to go through or hang up or disconnect that call. Once it's identified, we could send it to the professionals, to your point. It doesn't have to be handled at that line or level. It can immediately be routed over to where it would belong or where it should live at its inception.
And Sabrina, but I know I'm pretty tight for time this morning, but
Yeah.
I'll leave you with this, right? It's okay to ask for help, right? One of the bravest things that you can do is to reach out and ask for help. It's okay to ask for it for yourself. It's okay to ask for it for your children. It's simply okay. And there are resources out there that are there specifically to help you when you ask for that help. So I think more of these sessions would be good. I think as much as we can get that data and that information out, it would be really good. And like I said to you earlier this morning, I will put you in touch with the right people at Riverside in order to just get that data, that information that you can publish. And DA Cruz would be happy to share all of that data with you also.
Thank you, Patrick. We really appreciate it. And we'll follow up on Tuesday with where those links will live after we get them posted today. And thank you. Good luck on your day.
That's right. Great. Thank you, everybody.
Thank you.
Thanks. All right. So I'm sorry for that little sidestep to the left, but knowing that these resources are actually there, publicizing them, putting them out there, and having conversations between regular Pembrokians. I mean, having these conversations that say, what can I do to support that? And I didn't know that. Actually bringing this into the light of day can do such a world of good. And I don't want to step away from that, but I wanted to ask Lisa, who's joined us today. Thank you, Lisa, for being so patient for that, that version. To not only will we circle back to that and incorporate some of this into the rest of our hopeful, messaging to everyone, including those who may be underserved, but the governor has started to make some motions. He started to give some indicators. And some of that is case-based, some of it is based on need. And what we were talking about earlier with the idea of a cauldron or a bubbling point. You have people that just want to see action or a first step, or at least that other people are doing that research. And you're on those calls every day. Can you talk a little bit to that and bring that out to us?
Sure. And I'm going to take a step back to what we were just talking about. I think it's important to note the governor obviously has resources available to him, staff of all varied types and skill sets that are no doubt factoring into his decision making. A lot of people mistakenly think that everything the governor's done has been 100% health orientated, and I would disagree. And the reason we're seeing evidence of that is, I think, while some people have been applauding of the governor for moving really quickly with, stay at home, facial coverings, whatever you want to call it, I think in every aspect, the governor's been very cautious. And I think it's where we are today that the governor's best mental health experts were saying we have to be cautious about how long we're in this type of scenario. I'm sure his financial advisors were saying to him, if we go this route, we can only be in this type of scenario so long before we're going to have real economic problems that are not going to be easily recoverable. So here we are looking at the numbers, and I think again the governor's being cautious, but we are seeing that turnaround. We are seeing the governor's team in every way, shape, and form demonstrating reopening types of businesses, scenarios that would be safe, conditions to make those scenarios safe. And I think all along that there's a very good chance the governor's been getting very good advice from mental health experts, from financial experts, from other fields, with how long this can be sustained. And of course, he can't know everyone's personal case. That's not what I'm talking about. But I'm talking about as a societal overview of Massachusetts, of how long certain things can be maintained before there's, more, if you would, damage than there is medical gain. And I think that when you listen and you kind of read in between what he's been talking about, I think that he has been cautious to all those points. I don't think the governor wants the state to be in a shutdown for a long perpetual time. I think everyone knows the ramifications are going to be very hard if that were to continue. On the other hand, we have to open up safely. And on the other hand, you have to see this disease backing off in order to open up. But I think we are seeing those numbers. And again, to your point, yes, it was yesterday's press conference. It was the first time I really saw him talking about reopening plans, reopening dates, reopening strategies in a concrete fashion. Certainly my teleconference with the state on Tuesday was the first time I'd heard the state talk about concrete dates and times and types of businesses and outline, if you would, not an exact prescription or written order of how businesses would open, but for the first time talking about hypotheticals or an outline of how businesses and what types of businesses might open. So I think we are seeing that new late May model is absolutely going to hold. And I think it's going to really depend on how well businesses prepare for reopening, how well people prepare for reopening, how well people adhere to social distancing, and how well people adhere to facial coverings that is going to dictate how fast and how much we can do. And it is my hope that we can get back to and I don't want to keep using new normal. New normal is getting very cliche, but we get to being able to operate in a societal norm like we would know, with some adjustments to allow for public health safety.
No, thank you. And before we turn this back, and I'm going to ask in just 1 second, the district attorney to talk about his office, how his office is structured, and any plans he may be thinking about as everything starts to phase into a new way of doing business, not necessarily just with locked doors. But before I do that, District Attorney Cruz, to report back on what's happening on the town level, okay? One of the things we're seeing as we've gone department to department to do that status check and find out where we are and find the barometer of the success we've had with locked doors. How are we serving the public? Are we serving the public? What's working? What isn't working? To go to a phase, what would we need to do? We're finding that we've been potentially accidentally very successful with remote payments, collection of bills, collection of taxes, submission of applications in the building department, wiring inspections. Suddenly we're realizing that with the door locked, we haven't seen a huge drop in service to those two departments, which generated about 65 to 70% of the foot traffic beyond the assessor's and clerk's office. Mm-hmm. So it's an interesting thing what you can learn when you go into a situation like this. It doesn't mean we keep the door locked, but maybe there's a more reasonable way to do business that puts us less face to face, but yet more accessible. So to that point, Tim, your office right now is working, but you have made some changes, some implementations. And what do you see about the current structure versus what you could move to?
Well, I mean, that's obviously myself and my office has been talking to other district attorneys' offices here in the Commonwealth to see where we're going to be and what are we going to do, especially in light of the fact that the dates for reopening have really kind of changed. I think that, we've been trying to keep within the conforms of the orders that have come down, keeping 10 people in the building. We've had people working remotely at home. We've had rotating assistant DAs coming in to do the bails and things such as that. Victim witness advocates who reach out to the victims in the cases to let them know what's going on, if somebody is potentially going to be released and how that would affect them. We have administrative staff here. So I think that, we continue to try to deal with the challenges and to see what's going to occur on June 1 when the courts allegedly are going to open up again. Now, I really don't think it's going to, I think kind of like what the governor said the other day for the Commonwealth, it's not going to be, we're going to open up the doors and things are going to turn back immediately. I think it's going to be a slow roll. And I think we're going to slowly but surely put it in there, and I'm sure there'll be other rules that we have to deal with. And some, we in our county, which obviously Pembroke's one of our 27 communities, we deal every year with approximately 18,000 criminal cases. And we have so many people that are involved and affected by that. And we're so really lucky to have a lot of really good police, fire, first responders who make a huge difference in not only keeping people safe, but also helping us do our job and trying to hold people accountable. And just getting back, when we talk about maybe you don't understand, some people don't know what the DA's office does. One of the other things that we do on a daily basis is that we have established for the last number of years now, the Plymouth County Children's Advocacy Center, dealing with the kids in our county who have been hurt, who have been neglected, who have been abused. And we have professional people that work in that building, forensic interviewers. Most of the cases that we get referred, and unfortunately, the numbers are really high. Just our little county of 500,000 people, last year we had approximately 1,200 complaints of neglect and abuse of children in our county. And the majority of the kids who get hurt are usually hurt from somebody that they know, somebody from their home, somebody that they're related to. And I think that's always a challenge. And how do you keep that child safe? And that's why it's so incredibly important now more than ever for people to reach out if they make an observation of a child who, like we said earlier, is not in school, is not going to maybe Sunday school, is not going to their doctor, is not going the normal things that they have. And if you make observations that maybe they're different, their physical appearance, how they engage with you, how they've been supervised, it never hurts to be safe, to call DCF. Most people that get calls from DCF's not going in to take children out of homes necessarily. They're going in to provide help and to bring services. And if there is, like was mentioned earlier, if there is an issue with the food or job stress and the challenges that people are facing right now are so different. And it's the perfect storm in the homes right now with all the things that are going on, the police and the fire have to respond to. There's so many balls in the air that I think that we need to continue to work together because I've reached out to us. We've been notified by, MOVA, which is the Mass Office of Victims Assistance, MACA, which is the Mass Children's Alliance, and also the Children's League of Massachusetts about how the numbers are down right now. So what I would suggest is that people obviously, when in doubt, and you see a child who you think needs help, and you may not be a mandated reporter, I say now more than ever, that child may need some help, and let's get them that help. And in my office, as we proceed down this path, things will be different. June 1, we're up and running. July 1, allegedly, we're going to start with jury trials again. If you have questions about anything regarding your cases, if you're a victim, if you are a witness, give us a call. We're here to help you and to navigate our way through the system. So many challenges right now, and it was great. Patrick talked about the mental health issues that are going on right now. I mean, I think if you ask the police or fire, some of the biggest issues they deal with are mental health issues in conjunction right now with drug overdoses and drug problems that are ongoing. So people that need help with that stuff, Plymouth County Outreach, Plymouth County Hope, there's help out there, and let's get the help to save the kids who may be the next level of the things that we're doing in our office, trying to help drug endangered kids who themselves are not using drugs, or perhaps their parents do. Perhaps your parents are involved and these children have what's known as an ACE, an adverse childhood experience. Trying to help the next level of child so that we can stop cycles of domestic violence, we can stop cycles of child abuse is so incredibly important. And that's what I've been committed to here in the office, and I think my office is committed to it. And we're really lucky to have a great working relationship with all the people in Pembroke and the chiefs and the fire and the police and all the people that are there. So I thank you all just for the opportunity for what you do every day and for the opportunity just to hear a little bit about what we do in the DA's office.
Sabrina?
No, thank you very much. And Lieutenant, yeah, go ahead, Julie.
I'm sorry, I do have a question.
Do you have a
and I
question?
think it's for both the DA Cruz and possibly Lieutenant MacDonald. The questions came in about neighbors, people that hear or see something, but they're afraid, it's not my business, I shouldn't say anything. Can you just give people who are not direct reporters a little bit of guidance on what they should do if they suspect there's a real problem within a home that's near them? I don't know who wants to take that one first. Maybe Rick?
Well, we get those calls all the time. They're like well-being checks. Basically, they can remain anonymous, so they don't have to be named. And we can follow through on that in that aspect. But that still happens. I mean, if you see something, say something.
Yep.
Yeah, I agree, and I think that now more than ever, right? And I've been reading articles from across the country right now regarding a lot of those situations. Like perhaps somebody's homeschooling their kids and they're online and they hear a mother or a parent screaming in the background at other children. What do? You don't want to get involved. You hope it's just something. Maybe it's just a bad moment. But what if it isn't? What if it isn't? What if it's something worse than that? So you can call, like the chief said, you can call the Pembroke Police anonymously. You can also call the DCF Child at Risk Hotline anonymously. And if anybody needs that number, it's 1-800-792-5200. That's 1-800-792-5200. I would always fall on the side of the child, and if they show up and it's just a bad moment for a mom or a dad, whatever it may be, then they will deal with that. And like I said, if they need services, if it's a job issue, if it's a food issue, and they're struggling, and that's what people they're struggling, and that's why it's more important than ever to be understanding, to be a good neighbor, and don't forget the kids. The kids are they need our help. And they're the ones that we need to make sure that we're taking care of more than anybody. So when in doubt, I would also call.
Okay, thank you. Sabrina, back to you.
Thank you, Julie. This is not only great information, but Julie's point is well taken. Not everybody out here, including myself, is a trained professional knowing what to do in any given situation, and we're doing the best we can as neighbors, as friends, as community members. And some of this is just intended to bring out to everyone the fact that there's help out there, that we should all do our part, and that together, maybe we can make things better for people who just don't know how to break out of this themselves. And honestly, it's been a real struggle just to understand why we don't talk about it more. Why don't we share some of this information? And to be honest with you, you guys are very busy actually in the field doing what you do. You're all part of the solution on a different front. And the rest of us at home have no experience, may not have any context for some of this. And then there are some people who just don't know how to take that first step. And some of the resources we want to post and get out there are for those people who need to take that first step. But to the DA's point, and thank you for that, we also want to include some resources for people who want to help but don't know how. There's a lot of positive messaging that can come from this, but to talk about it and understand it is the first step, because if you don't talk about it, it's not there, and it very much is there. And that isn't meant to bring us all to a place. It's a good thing to peel back a layer and take a look. Maybe you can make a positive change. And thank you all for that. As we go around to get ready to wrap up, the next piece that we're going to see in this last week is people setting their own affairs in order to potentially head back out. I know in other states, I'm hearing from friends who may be making that first hair appointment, or maybe getting in a round of golf. I hear that may be coming. Like any minute, we're all poised to see who gets to golf. I mean, it's good stuff, but I don't golf. So I may just go see if I can walk around with a club. But there's changes coming, and they're good changes. So as we go around here, I've talked specifically about your offices and what you see has changed, but I'm going to ask each individual person in this next phase, this next wave, after this last week where everybody holds the line and doesn't mess it up, as we come out, what would you like to see? What do you think are some of the possibilities for responsible interactions? And what are some of the things you do not want to see that could set us back? And I'd like to start with Lisa. Lisa can jump off on this point well. Can you start us off?
Sure, I can. Things I'd like to see come back. Everything. I want everything back. I desperately want hair appointments back. I desperately want nail appointments back. But all joking aside, our success is going to be dependent on, like so many things in life, how much personal responsibility we take. And our level of personal responsibility is not just to us, but it's to our fellow human being. Raising our level of sanitation, washing our hands, being cognizant of all the things we touch, being cognizant not to touch things that we don't have to touch, and wearing some sort of facial covering so that we are not expelling fluids from our body onto others or into the air where they could get into other people. Those are going to be the keys. You see the running joke online all the time. If masks protect me, why am I out of work? And if it's unsafe to work, why do I have to wear a mask? Well, I think that's a little short-sighted, because I think the reality is, in order for people to be in close proximity when a disease is circulating, facial coverings and minimizing contact are going to limit that virus or disease ability to move from human to human. So I think our success is going to be predicated 100% on how well, as a collective group, we follow those things. We avoid contact with each other. We avoid contact with solid surfaces we don't have to touch that could transfer the disease. And we take care of our own personal hygiene and our own personal face coverings. Things I think that are going to be back first, I'm going to be really excited. I think golf is one of them. I think sports that don't include physical contact could certainly be back online. I think we could see some sort of child activities return in a small group format, not, massive group activities, but small group activities. Again, that's going to depend on how well parents are able to teach their children about a higher level of sanitation and why facial coverings are important, especially if you are going to be in a group setting. I think we could see outdoor dining return, probably before interior dining. I think interior dining could probably return in phase 1, maybe phase 2 at a much lower capacity. I think private businesses, especially with smaller numbers of personnel or personnel that have individual offices or individual spaces that are 6 feet apart, I think all of that could come back online. I think business owners are going to have to be really vigilant about cleaning. That's not to say that, businesses are dirty. That's not what I'm implying, but I'm saying there's going to have to be a heightened level of cleaning and sanitation from a day-to-day standpoint, whether that's handled by the business or a cleaning service. I couldn't answer that. That's going to be different for each business model. But I think a lot of those things are to come back. The ones that are going to be the most problematic are the ones that have always been the most problematic, the ones that require physical contact between persons. No one's going to like to hear this, but the reality is things like youth sports. That's going to be really challenging. Anytime you have people breathing hard, sweating, coming into physical contact with one another, that's going to obviously be very problematic from a disease transfer. I think everyone's heard of, there's different cliche diseases associated with each sport that most school parents are familiar with. If they have a child that participates in sports. But those contact sports are going to be problematic. And unfortunately for me, personal care services are also going to be problematic, because that's going to require human-to-human contact. Obviously, a lot of the personal care services have dealt with disease before and are highly trained in how to not transfer diseases, because they're working on multiple persons and sanitizing of stations and tools in between clients. But I think there's going to have to be an even higher level of vigilance. And again, I think that's going to be on the part of the patron, because while our professional estheticians, hairdressers, different salons that work on nails and all those kinds of things, while they have always been hyper vigilant about protecting themselves, working on multiple people and not transferring diseases from person to person, now the patron's going to have to get involved, because they don't have the right to come in and bring in disease and possibly infect staff. So I think that one's going to be a little more problematic, and I'm most interested in seeing the directive of the state on that one. And again, personal responsibility and the level to which we as a society respond to that is going to 100% dictate how much can open, how quickly it can open, and how successful those openings will be.
Thank you. That's a lot to think about, actually. Now, last week, DA Cruz mentioned that the Plymouth County prisons, the prison system, was in great shape and didn't have an outbreak or a significant spread within its community. But the DA also referenced the possibility that courts could come back into session June 1st. And it's not so much the living centers or populations, but there's going to be a lot of transferences back and forth if that happens. People moving from one location to another in small proximity. One of the things that we haven't really talked about are things like school buses or GATRA vans or trying to put a lot of people on transport. So has DPH had any indication that they're even there yet, or is that just still out on the horizon? And to the DA's point, June 1st, we don't know.
So as far as public health has addressed mass transportation. Obviously, the MBTA is, if you would, the canary in the coal mine, testing that out. I know that the MBTA, my husband works for the MBTA, in interest of full disclosure, has taken on a massive effort, largely with the use of foggers on all trains, buses, any group gathering stations, things like that. They've taken on a massive effort as far as that sanitation. I would imagine the data being learned from the MBTA, I would hope, would be transferred to things like GATRA buses, Brockton area transport buses, Worcester area transport. Certainly, I would think that the prison systems or any other government agency that has to move a large number of people would take a look at that. And I think that's what you're going to look like. Again, facial coverings, even for prisoners or whether it's seniors taking a ride to the hospital. Certainly facial coverings when you're sitting on any kind of transportation is going to be a necessity. You're going to be within 6 feet of people. And I think in between quote unquote groups or within certain time chunks of having moved different populations, that all those agencies are going to have to develop a protocol of whether it's every so many people or so many hours going in and what we call fogging. And I should take a step back. Fogging is not dangerous. Fogging is not scary. It's a contact sanitizer that is proven effective on the coronavirus. So it's something that's being used widely to go in. I think the residue shortly after dissipates. I believe it's a couple of hours. Don't quote me on that. I know some of the fogging solutions are a little bit different. Contacts and dissipates, and then it's perfectly safe to touch and everything else. So that's what I'm talking about when I say fogging. It goes in and it eliminates the virus from all contact surfaces. But I think instruments like that, I'll be very surprised within the court and the prison system, because they're going to be moving multiple people through the same locations. If that kind of cleaning and sanitization isn't employed, I would think it would almost have to be.
DA Cruz, to that point, you've already done, or I'm sorry, not you personally, but the office and the state has done a lot virtually to date on arraignments and other things. Is there going to be, or do you think there could be a time where you are transporting less to a courthouse, to an arraignment, to face-to-face and more virtual experiences with the folks in your office and prosecuting and trying to get people in front of a judge? And how do you envision that future? I mean, I know that's a big ask. I know you're not responsible, but what are your thoughts? Can you just share some of those in conjunction with what Lisa said?
Yeah, sure. I mean, we were doing virtual arraignments prior to coronavirus. It was just starting up again here in Plymouth County. Actually, we started it really 20 years ago. And we were doing it at that time. And then there was motions that were filed saying that it was a violation of someone's constitutional rights, so we stopped doing it. But in the last year or so, we've been up and running and doing that. And so I think there'll be less transportation necessary. I mean, if you've seen the sheriff's transportation buses, they're not really that big. You know, I'm not sure if they have any more than 8 to 10 people at any given time. And for the most part, they'll bring individuals up here. One of the things I had tried to do when we opened the Superior Court for Plymouth County criminal session down in Plymouth was we tried to focus on keeping our Wareham and our Plymouth cases down in Plymouth. So that way the cases up here in Brockton would just be the Brockton cases and the Hingham case. But that would be less of a transportation, because the Plymouth County House of Correction is about a quarter of a mile from the Plymouth County Superior Courthouse. So it would nominalize the need for the distance and the transportation. But I think, I think you hit on it. I mean, the sheriff's office does a tremendous job in really challenging times. I can't imagine a more challenging time for Sheriff MacDonald and the people that work from down there right now than trying to keep people, keep the virus out and making sure the people inside are safe. And I know that they have the quarantine procedure. And I think I said last week, When I tried to get on the premises a couple of weeks ago, they have an outhouse, for lack of a better word, where a man's standing there and takes your temperature. And if you don't pass the temperature, you're being turned around. You're not going on the premises. So they're checking and making sure that they keep people away. I think that's why you've seen the numbers in that institution anyways down so much. And I'm hopeful that that we're going to be able to continue to do that for us. All I can say, going forward from here, I think that we're going to continue we're always going to have jury trials. I believe we're going to bring people into court because there's a confrontation clause and defendants have a right to accuse and confront the people who are confronting them. So there are always going to be jury trials that way. As to when they're actually going to gear up again, I'll be interested to see, because it's also July 1, supposedly the jury's trial date. That's also right around July 4th. And that's notoriously been a slow time. And much like Christmas and New Year's is a slow time on the other end of what we do. So I don't know when it will actually gear up again, but I'm hopeful that it will be, so that we don't have too big of a backlog. But the people that work for me right now are getting their cases. And like I said to them, whenever the curtain finally pulls up, I want to be ready to go. And I want our cases to be ready to go so we can eliminate backlogs, so we can make sure cases move in a consistent fashion that they should, because we have very serious cases that need to be dealt with. And on the other end, Sabrina, I would just say, I just hope that when this is all said and done, people can be kinder and gentler and go a little bit slower. And I'd like to see more face-to-face interaction than phones and videos at that time. And I'm hopeful that we're going to be able to do that again. And people can just remember that we're all in this together, and that we all need to remind ourselves we'll be through this soon enough, and we all need to stay safe as long as we can.
Thank you. All right, Deputy Chief McCormick, it is, as DA Cruz reminded us, Mother's Day weekend. From the Pembroke Emergency Management standpoint, what are good things you can do for your mother, and what do you not want to give your mother for Mother's Day?
You don't want to give her the coronavirus.
I knew he was going to do that.
So just stay away from that as much as possible. No, I mean, there's a lot of things you can do. I mean, I'm sure people have gone to visit their moms and dads, stayed a safe distance away, masked up. They're on the porch or out in the front yard or in a chair or something. That's all fine. Florists and things have opened up, so you can send some flowers and you can do stuff like that. I would say not to go visit your mother, but you just got to be safe and keep doing what we've been doing, for the last 2 months, 3 months. And on the other point of that, there's very little that the fire department can do virtually, because we're a hands-on, touchy-feely type of organization, whether it's from fires all the way down to, business inspections, 12 different type of business inspections. So as we start to open up, I would just ask that the residents and businesses be patient on this end of it, because we do have to get in and inspect. Lisa has to inspect. I have to inspect. The building department has to, and we can't do them all at the same time. It wasn't easy shutting them all down, and it's not going to be easy opening them all up. So just be patient, be safe, and happy Mother's Day to everybody.
Thank you. Lieutenant MacDonald, you get to close us off today. What do you want to see happen? What don't you want to see happen? And what should we give and not give our mothers for Mother's Day? Go for it.
Well, I'm just on the Mother's Day thing. I'll just ditto on the acting chief, what he said. But going forward, as we transition, be rational, transition to these phases into this normal life. Remember, the resources for public safety have never changed. We're here 24/7. Although we're trying to reduce visits to the station, we're always a phone call away. Happy Mother's Day.
Thank you very much. And I want to take a minute to personally thank the acting chief, Ken McCormick, Health Agent Lisa Cullity, Police Lieutenant Richard MacDonald, and DA Cruz, DA Timothy Cruz out of Plymouth County, for joining us and sharing some of the good work, the good word, and the good things that we can all be doing in this last period of time. And I do want to say, Happy Mother's Day, Mom. I love you. Thank you, Julie, for hosting today.
But we do,
And,
Sabrina, we do have two other
also have a
questions.
lovely Mother's Day.
Sabrina, we do have two other
Yeah.
questions that have come through. I'm sorry.
I'm
one
sorry.
resident would
Go
really
for it.
one resident would really like to know if there's been any deaths in Pembroke from COVID-19. Lisa, maybe you could answer that one.
Yes, there has, but it's not a statistic that is reported back by the state. We were made aware of them by the family, but yes, there have been fatalities in Pembroke, sadly.
Okay, thank you. Yeah, that is a shame. And the second thing is about the hope fund that has been set up that you can get to from our
Yes.
website, but you can't get to on a mobile device. And there's a few people that would like to be able to donate via their phone and they can't do it. Is that going to be made possible in the future? Sabrina, you might know that one.
Well, thank you, Julie, because that is the first I am hearing of that. I know what I'm doing this afternoon. We will get that up for the weekend. That's very important.
Yeah,
That
and
whole
I
fund
just-
is very important.
Yeah, I just tried it on
No,
mine.
thank you.
Yeah, I just tried it on mine, and it says just not available yet to be done on a mobile device. You have to do it on a laptop. And just to end the thing, this was a great episode today. A lot of really good information, and I hope people will realize that is filmed on this date, date stamp every day. And the Hope Fund, and there's other towns that are doing other funds that are going to really help small businesses and families that are struggling, that will be going onward and onward down the road. This isn't, because things open up doesn't mean that people are back to where they were before. So please do educate yourself about the different ways that you can participate and help your fellow business people and your neighbors and your fellow community. Anything else on the Hope Fund at all, Sabrina, before we sign off for today?
Well, we went from $2,500 up to $4,300 over the weekend. Couldn't be more grateful. And Lisa worked with a gentleman who is a private business owner. And I'm going to actually ask her quickly to throw in a plug for the Hope Tree, because that has lit up our center.
Christmas decor.
And I was just Christmas decor, and he made a lovely donation to the Hope Fund and is encouraging others to do that. Lisa, want to close it out with the Hope Tree?
Sure. If you haven't had a chance to see the fantastic Hope trees on the town green, do go by. The gazebo is decorated. The Hope trees are 4 beautiful Christmas trees, all in synchronization, that go through over the course of about 5 minutes. A little mini light display, well worth the time. Please do so safely and mindfully. Don't get any accidents. If you really want to go by slowly, please pull off of Center Street as if you were going into the library. Take a left, drive down in front of the community center. That is one way, so you should only enter from the library side. Then you can proceed more slowly, enjoy the light display, take your kids to see it. It will be here for several weeks, although the flag will be leaving shortly to go to its next destination. But the Hope trees will be here for several weeks. But do take a time to go by and enjoy them. It looks nice on video. It is even more spectacular in person. And again, to remind everyone to be aware that if you do have the ability, please donate, please help. Every dollar given to the Hope Fund is going to go to families in need and adversely affected by COVID-19 right here in Pembroke.
And Julie, as a final note on that, we had a lovely call from someone who said his circumstances hadn't changed much. He and his wife were still employed. His children were home, obviously being homeschooled or schooled by their teachers in their home on a virtual platform, needing their support. And he donated their unused lunch money. Because they live pretty close to the margin, they don't have a lot of extras to give. But they appreciated the Hope Fund and they appreciated the concept. So they took the money they did not spend on their kids' lunches for the rest of the school year and donated it to the Hope Fund. And it was so touching. There are a lot of people in the community that could really use the assistance. And Julie, the applications are on the website as well if you're someone who needs some help from the Hope Fund. And I want to thank you very much for everything you did today. Thank you, Julie.
Yeah, thank you so much, Sabrina. Thank you. What a great group. Join us again every Tuesday and Thursday at 9:00 a.m. for the Pembroke COVID-19 update. This is Julie Thompson, and the watchword for today is hope. There is a lot of hope, and there's help. So dial 211 if you need anything, and we'll talk to you next week. Thank you.
Take care.